Hi. If you're not already practicing a series of movements within a category called Pelvic Lumbar Stabilization, I encourage you to begin. Of course, with everything, double check with your healthcare providers if this is appropriate for you. And when you are unclear, be sure to work with a professional movement educator to help you understand things a bit better. So to begin, we'll be working with a movement called marching, which is basic pelvic lumbar stabilization exercise. Now, to double check that you're doing it correctly, you'll want to first start in a position that we call pelvic neutral. So that means you are not in a posterior tilt. You'll know you're in a posterior tilt because you feel your low back pressing down. We don't want that. We also do not want an anterior tilt to the pelvis, which is where you have all this daylight underneath your low back and rib cage area. What we want is something in between the two, which is pelvic neutral. So first and foremost, you can make a triangle shape with your hands and place the heels of your hands on your frontal hip bone, your pointer fingers, your index fingers, on your pubic bone. And what you want to feel is that both of those are in the same plane. And then bring the base of your ribs down to the earth so you'll feel them touching the floor of the mat. And what you will also feel is that the low back still has its natural lordotic curve away from the floor. So again, if you're unclear on what is neutral pelvis, please work with a movement professional near you who can help educate you on the concept. So with the pelvis in neutral, relax your shoulders, relax your head and your face. So upper body soft, relaxed and grounded. Pressing into your left foot on an exhale, raise your right leg up. Breathe in, and as you exhale, right foot to the ground. Push with your right foot, left leg up. This is just a very simple movement we call marching. And what we're watching for is that there's not a lot of movement here in the pelvis and lumbar area. That the ribs continue to stay down, the pelvis continues to anchor, and the low back maintains its natural lordotic curve. So what will happen with students is that the pelvis will rock or sway or the ribs will pull away from the mat while they're marching. And those are signals that the movement is too large, maybe the movement needs to be smaller, and the foot barely comes off the floor. Of course, you're breathing with every movement. Exhale as you push with your left foot to raise your right foot up. Inhale to return. Just as long as you're breathing, it's okay which side of the movement the inhale's on and the exhale is on. A more advanced version of marching is to have the legs in the air. Once again, we're looking for pelvis neutral. Pubic bone, frontal hip bones in the same plane, base of the ribs down, and a natural lordotic curve to the low back or the lumbar region, which means the low back will slightly be peeling away from the floor, but the bottom of the ribs are in clear contact with the mat. As the legs are in tabletop with knees above your pelvis, upper body relaxed, continue to breathe, and on an exhale, point your toe, so out of the ankle joint point, toe tap down. These are called toe taps. When we change the angle at the ankle joint, it becomes a heel beat. So heel beat down. Toe taps are when the toes reach for the floor. Change at the ankle joint. Heel beats are when you change at the ankle joint, go into flexion, heel touches down. Now again, the range of motion of touching the floor may be too great for some. It may put strain on the low back, which is an indicator that range of motion needs to decrease, or maybe the number of repetitions needs to decrease. On an exhale, 1 foot at a time returns to the mat. Again, if you're unclear on pelvic lumbar stabilization exercises and whether or not they're appropriate for you, please talk to your medical team and a movement professional near where you live who can help you understand them better.